Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Dysmenorrhea. Dysmenorrhea is defined as pain during menstruation. Dysmenorrhea usually it is a cramping type of pain in the lower abdomen. Dysmenorrhea is of two types: primary dysmenorrhea and secondary dysmenorrhea. Primary dysmenorrhea or spasmodic dysmenorrhea. In primary dysmenorrhea, the pain occurs during the ovulatory cycle and it is because of myometrial contraction. Now, this pain is due to prostaglandin release, that is PGF2 alpha. This pain is not associated with any pelvic pathology. The patient is usually a young female with complaints of pain during the menstrual cycle since 1 to 2 years after menarche. Initially, there is no pain because the cycles are anovulatory. It is more common in females who have early menarche, or if there is increased intermenstrual period, or if there is increased menstrual flow, there will be pain. But this pain gradually decreases on its own after marriage, or if you give physical activity to the patient or with reassurance, the pain gradually decreases. The pain begins in the menses and or just before menses and gradually decreases within 72 hours. The pain is spasmodic in nature, it is intermittent and varies with intensity. The pain is centralized and is in suprapubic region. Pain may be associated with psychological factors.
thank you and thank you for watching.